Well, good morning, everyone. Thank you for joining us for this very important campus conversation today. I'm Brett Lee, Vice President of Communications and Marketing. I am here with our Chancellor, Dr. Richard Rhodes, along with several members of the Chancellor's Cabinet, representatives of our Return to Campus Committee, and a representative from our Student Government Association. Together, we're here to discuss ACC's ongoing return to campus, or as we're calling it lately, the return to the new normal, which is a very important conversation to have. We do recognize that this is a very busy time for a lot of people, and we appreciate you joining us today. As always, for those who cannot join us live, we will be recording the conversation and that will be posted to the website immediately after. As a reminder, we're going to save as much time as we possibly can at the end of this conversation for questions. We've had several people supply us with some questions already, and we have those ready to go. You will be able to also ask questions in the chat feature of the live stream. So please feel free to do that. We have Jessica Vess on standby, ready to watch those and share those with us as they come in. The questions we're not able to answer will be posted to the FAQ section of the coronavirus website here at the college. So without further ado, let me turn it over to the host of today's conversation, our Chancellor, Dr. Richard Rhodes.
Thank you, Brett. I always enjoy these campus conversations because it gives an opportunity to talk directly with you about the latest events happening at ACC. And today our focus is what's on everyone's mind today, and that is our return to campus. And so I realized that, this is all unfolding very fast, and we're facing rising concerns and growing numbers of COVID cases in the region. But I want you to know that we're watching it very carefully on a daily basis. And our Emergency Operations Center team meets every week and sometimes multiple times a week to discuss the developments and review our plans. As many of you know, most of our colleagues across the state, colleges and universities, community colleges, have already returned to campus in a big way. And we took a more gradual approach. We've been able to keep our cases of COVID-19 low with no campus transmissions, and we want to keep it that way. So our priority is and always has been balancing our mission to serve our students and do everything we can to ensure their success with the health and safety of our community at the forefront. We've been in a good place to do a lot of good work remotely for over a year now. Well, actually, it's been 16 and a half months. But some of you have been with us from day one, and we couldn't have done it without you. I'm talking about our frontline staff who came to campus every day throughout the pandemic to keep our buildings running. When we needed tech support, you were here to collect, set up, and distribute those supplies. When we needed Wi-Fi in our parking lots, you made that happen. And as we slowly reopened the classes that needed labs and other critical hands-on learning on campus, you were here to keep our campuses clean and safe. All of us appreciate everything you have done. And right now, in preparation for fall, more of us are returning to campus. And I've asked that each unit of the college develop and be ready to implement their return to campus plans by no later than September the 1st, which is the beginning of our new fiscal year. These plans will vary depending on our roles and responsibilities. Some of us will need to be back on campus providing in-person services before classes begin. And some of us are already here in our office or classroom, and others may continue work remotely or a combination of both. This is, as Brett said, a new normal that requires all of us to remain flexible, patient, and vigilant as we work together to fulfill our mission. As you know, the pandemic is ever changing. We're monitoring it every day, working closely with local health authorities and discussing our options thoroughly with our partner institutions. As a public entity in Texas, the state does not allow us to require or mandate masks. And we're also limited in other ways, but there are things that the college can and will do to ensure everyone's health and safety. And I hope to give you a better idea that in our conversation today, and hopefully ease your concerns. And ACC is in a good place thanks to incredible teamwork at this college. And I'd like to take a moment to thank the EOC team for their leadership, to thank our Return to Campus Committee for bringing forward faculty, staff, and student concerns and ideas, and our employee associations for staying connected with their constituencies and providing feedback. And thank you all of our faculty, our staff, for your ongoing flexibility, patience, perseverance, and commitment to serving students and each other. We have representatives from all these groups here today to help us share this information. So I'd like to start the conversation with an update from our EOC team led by Executive Vice President of Campus Operations and Public Affairs, Dr. Molly Beth Malcolm.
Thanks, Dr. Rhodes. You know, everybody, we're dealing with a new normal, and this new normal is going to be the normal going forward. We have changes every day. So one day we may say, here's what our guidelines are, and then it changes. It's ever changing. But what we've done over the last year and a half, and what we're going to continue to do, is to follow all the CDC guidelines for COVID-19. But right now, the most important thing you and your friends and family and students and everybody can do is get the vaccine. And I know a lot of you have already had the vaccine, but as we also are aware, there's the Delta variant is coming through. It's a whole lot stronger than the original strand was. But the one thing that we know is if you've had the vaccine, if you've been fully vaccinated, even if you get it, it's kind of like maybe having a sinus or an allergy. It's very mild. What we have going on right now, again, with the surge, is what is being called by the CDC, the president, everyone. It really is a pandemic of the unvaccinated. Most people that are ending up in the ICU and are dying are those who haven't been vaccinated. And as some of our medical experts have told us, even here in town, what they're seeing now going into the hospitals in Austin, and I think this is entirely around the country, is that those people that are in the hospital and dying are younger. In the first COVID surge, and the second one that we had, the people were from 60 to 70 years old, and now they're from 30 to 40 years old. So it is really important for everybody to get vaccinated. You also know that we have been encouraged to wear masks again, even if you're vaccinated, if you cannot socially distance. Now, we can't mandate that for anybody. We are highly encouraging people to. And again, it's just so that we hopefully don't get it if we've been vaccinated, and we're helping those who haven't had the vaccination yet. But that's the most important defense that we can have. And the good news for ACC is we have 30 clinics being offered free and to everybody, faculty, staff, and students between now and September 30th. We sent out an email earlier this week, and that information is posted on the website. And if you look at that, you'll notice there's all kinds of options on which vaccine you want to get. I would highly encourage that you're either getting the Pfizer or the Moderna. Those are the two that are showing the best and longest impact. But Johnson & Johnson's good if somebody is only going to get one. And all of those options are available. And we'll continue hosting these vaccine clinics. In fact, there's one going on right now at Eastview, and it'll be over, well, I guess it's over about now. It was this morning. There are two questions that keep coming up. I want to throw to Dr. Mike Garcia to answer, and then I want to come back and wrap up pretty quickly. But Dr. Garcia, two things that people keep asking are, what do we do if someone is sick and comes to campus? And the other one is, will we continue contact tracing? And because Mike's been over these areas, I'm going to let him have a chance to answer those two.
Thank you, Dr. Malcolm. Yeah, we encourage folks not to come to campus if they're ill, especially if they have COVID symptoms. And what we do is recommend that they seek medical attention if they need to, so that they can work with their healthcare provider on what next steps should be if someone is ill on campus, we're going to professionally and politely talk to them and see what's going on. We're going to, our campus management team and our deans are going to work with that student or an employee and encourage them to go seek medical guidance also, and to ensure that they get what they need. And then contact tracing. So we will, and we continue to do contact tracing. We have a team that's trained through Johns Hopkins on the contact tracing protocols. And so we will follow up and continue to follow up with employees and students that are affected by COVID and work with them on more information that we need and instructions to give them on the process and what next steps they should do, and make sure that they have the resources they need to get through COVID. So those are the two main topics there.
Thank you very much. So in wrapping up my part here, I just want to say the most important things that we can all do are to get vaccinated. Is safe, effective, and free. Continue to maintaining social distancing and trying to avoid large gatherings. We do know as we all come back to campus, there's going to be more people on campus. However, we're not back at full capacity, and we're not opening the doors just to say, hey, anybody come in, walk around, do whatever. We are doing everything we can for everyone's health and safety. And the other part is, has already been mentioned, we cannot mandate indoor masking, but we are highly encouraging if during the spike in cases as a result of the Delta variant. Another thing I want to say is a big thanks to HEB, Austin Public Health, Travis County. These are the groups that are partnering with us for all of these 30 clinics that we have. So the week before school, the week of school, and the second week of the fall semester, we'll be having clinics on a number of the campuses around, trying to get to as many people as we can. Another thing I want to mention, this is absolutely not a requirement under any form or fashion. It is if you are interested. We have some stickers that say, I got my COVID-19 vaccine, and I don't know if you can see this. Somehow I've managed to, I didn't realize I didn't have my video on until just then. But if you can see this, it's a little sticker, and we will give you one to put on your ID if you're interested. The campus managers will have them. They don't have them yet, but they will have them. It's just for you, because I'm glad for somebody to know I've been vaccinated. But again, no requirement, nobody has to. But we've had a lot of people that were interested in having that sticker, so we'll make those available to you. Again, we're going to continue to do what we've been doing for the last year and a half, everything we can to keep everybody safe. And it has been an amazing team, the EOC, the return to campus, and all of the faculty and staff that have been working with us. And I do want to say, I still like, and I knock on wood every time I say this, and y'all have heard me say this every time we've had one of these, we've been very fortunate to date. We have had no on-campus transmission. And to date, from July 6, 2020 to July 23rd, 2021, we have only had 66 cases. That was 42 students and 24 employees that actually had come to campus and have had COVID. But again, no on-campus transmission. So we're doing everything in our power to keep you safe. And thanks for all of your help as well. I think I'm supposed to turn it over to Dr. Cook and Mike Midgley. So I'm tossing y'all the ball, guys.
Thank you. Thanks. And I would reiterate, we've worked very closely with our campus safety group for the last, pushing a year and a half now, as we've begun to bring people back. And so we'll continue to do that moving forward. And so a lot of the questions that people have about, and so I'm really glad, Mike, that you brought that one up, that what do I do if someone is in my class, or if a coworker, is displaying symptoms, or if someone comes back. Those will be, we're going to update our FAQs. We've been doing this for a while, so we do have FAQs on that, but we'll go through and do an update of those also. So a couple of things that I'll go through, and then Dr. Cook will pick up and add, and we'll kind of ping it back and forth as we go too. So one of the things that I think we need to understand is that while coming back to campus in the fall seems really intimidating to a lot of our folks, and it seems like a new thing, we have had both students, faculty, and staff back on campus since July of 20. Well, over a year ago, we came back for the first time. Now, we came back in limited ways. We came back with about 1,000 students that first semester in the summer. That fall, we brought back 3,000 students. This spring just ended, we brought back 4,500 students. So we've consistently increased the number of staff, faculty, and students that we've brought back. What we're seeing for the fall is we're going to up that number pretty significantly, but we have been back. We do have protocols in place, and we have been steadily working through this. This fall, we will probably have in the neighborhood of 15,000 students back on all of our campuses taken as a whole, not at any one time. They'll be spread out over the campuses, different times of day, different days of the week, but we will have that many. I would also mention, because these are the questions we get asked. That's a significant increase, and these are significant numbers. But if you do compare us to our peer institutions, the very large community colleges in Texas, because we asked them, what are you doing for the fall? If you compare us to our area universities, it's a very conservative approach. Most of our peer institutions, the large institutions our size across the state, are pretty much back to their pre-pandemic levels of face-to-face on-campus courses. We've taken a little bit different approach and increased this to probably about 40% of our students will have a face-to-face experience, either a fully face-to-face course, or it could be hybrid with a significant face-to-face component. So we are continuing, while this is a bump, it is conservative vis-a-vis our peers, and I think it's important to note that. And we do not plan to return to our pre-pandemic percentage of face-to-face this fall, or frankly, in the spring. And we may talk a little bit more about that, or Dr. Cook may when, a little bit later. We're going to change that up a little bit. So what that means, though, for us, and I think this is really important now for both our faculty and our staff, particularly our staff, what that means is when we have that many students on campus, that we have to be back on campus to serve that many students. We can't serve all those students remotely. And so that's really what's driving this. Serving our students is our priority. It has to be. And so that's really what's driving a lot of what we're doing with this. I know that your associate vice presidents have been working with you on implementation of bringing folks back to campus. I think that later today, I'm going to send out a memo. It's a little bit long. I need to trim it so that you will actually read it. But I'm going to send out a memo supporting what they've been doing, because we have been discussing that and I'm aware of that, but also clarifying a few things. I know I've gotten some questions, which we will talk about a couple of those. And I've been surprised when I got those questions. And so there's been a little bit of miscommunication, as you would expect, frankly, when we have this many people involved and we're doing this major return. So I will send out a memo, and the things that I'm specifically going to try to address in the memo I'll be sending are how do I access campuses, and particularly how do I access my offices now? What will be different now than before? What kind of safety considerations do we still have in place? What things specifically are we doing? Talk a bit about that. Vaccinations, and on two fronts. First off, what can we say about being vaccinated? Dr. Malcolm addressed that. I will reemphasize that. There are things we can't do. And also where to get vaccinations. We have been doing vaccination clinics on our campuses for months now, and we're continuing that through the fall. So they're readily available. You can do those. The process for requesting continuing to work virtually for some folks, they will want to make that request. We'll look at that and see, does it make sense? And I'll give you some of the conditions we'll be looking at when we look at those when I send a memo today. And then finally, what will the fall schedule actually look like? A lot of you are really familiar with that, particularly the faculty, because we have been communicating what we're doing with that. Others less so, but we'll break down what it looks like. We're probably going to be around 40% either face-to-face or a heavy face-to-face component of our sections. It's reduced class sizes. We significantly reduced almost all class sizes, not all, but most. So those are, the things that we'll be trying to cover today. I think that a key component of all of this, when you look at what comes out in our discussions, is for the last year and a half almost, we have been really flexible in dealing with changes. And if you look at the fall schedule and the journey we've been on trying to get a fall schedule together from last January to today, it has seen significant changes in updates. So we were talking to the Combined Employee Association leadership today, and I told them, I said, I'm sure you're absolutely weary of dealing with the fall schedule, so am I. But we change as we have to adapt to conditions, and I think that has to be a critical component of everything we do. And we have to be flexible, and we have to think about what we're doing. And here's an example of the kind of thing here's a question that we got for today. We received a question from an hourly employee. It was more a statement that I won't be able to work there anymore because I'm in a high-risk group and I know I have to come back to campus. And so I guess I'm done with you. And so maybe, but maybe not. If you are an employee in a high-risk group, as an example, in an area where we maintain both on-campus and virtual activities. So it isn't like I am a technician in a lab where all the students are in the lab now. If we do that, we should be looking at that and saying, okay, does it make sense? Can we work with people? And we will do that. And so sometimes we'll be able to, frankly, other times we won't. And the overriding concern again will be, can we serve students equally well from a distance, or do we really need to have folks back on campus, and what are the parameters for that? Just a couple of other things, and I will turn it over to Charles then. A couple of questions that have come up, and I think it'd just be good to address them now. One of the things we got, and Dr. Cook did address this with the Employee Association leadership, is we're trying to get a balanced blend of courses moving forward. We do face-to-face courses. We do hybrid, which are part online and part face-to-face. We do online synchronous, which is online, but they have class times and meeting times so that you get some class activities. And we have online asynchronous, which is just you do the work yourself and we don't have class meeting times. We're trying to get a balance of those moving forward. Our students have done really well with the online courses. We've done tons of work in improving the quality of those courses. And so we would like to maintain a balance of that. The question came up, does that mean 25% of each one of those 4 categories? Absolutely. And no, the answer really isn't that, particularly at a departmental level. We've even gotten said, do all departments have to do 25%, 25%, 25%, 25%? That will be difficult for the welding department, much easier for other departments. So we're looking at this as a general aspirational goal. We would like to have a good blend of different kinds of courses for students and frankly for faculty to teach also. So that's one thing. The other question we got as a part of this conversation is, in our administrative rule, we have a requirement that faculty teach 40% of their primary load, not their full load, but their 15 hours on campus. We've suspended that, obviously, during the pandemic. We're going to suspend it for the fall. We're looking at re-implementing that for the spring at the earliest. We will re-implement it, but just not for the fall. We can't. We're not there yet, and so it doesn't make sense. And another interesting one, will those teaching online be required to teach those sections from their campus offices? No, you won't. There may be other things you need to be on campus to do, participate in other activities, but we're not really expecting you to necessarily teach your virtual courses from your office. There are other, like I say, there are other things that you may need to be on campus to do, but again, that's a separate discussion. So I think those are the primary things I wanted to cover. Like I say, for all the instructional personnel, both faculty and staff within the instructional unit, we'll be sending out either later today or at the latest Monday morning. I'll try to get it out today. It's written. Just really clarifications. It won't answer all your questions. And so if you have others, you can send those forward. Or if it's less clear than I hope it will be, you can certainly ask for additional clarification, but I'm thinking it will clarify a lot of the issues and the processes that we're going to be trying to go through moving on into the fall. So I think I'll stop, Charles, and let you take it away. Thanks.
All right. Thanks, Mike. That was a lot.
Yeah.
And thank you for your leadership, for your flexibility. And I think that's what we want people to hear. The bottom line is flexibility going forward. This has been a tough year for everybody. It's been tough on faculty. It's been tough on students. We all had to adjust to new ways of doing things. And man, my hat is off to all of you. I can't believe how successfully students have done, how well faculty has done, how well student affairs has done. You've all stepped up to the plate. You've figured out how to do things online as well as face-to-face, and a combination. And I think that is the new normal going forward. We're going to offer everything we do online, face-to-face, hybrid, according to the needs of the students in our community and according to our resources. And man, y'all have closed equity gaps. You've engaged in hours of professional development. You've made your courses much more engaging. We used to have a 10% gap in the success rates between students in distance ed and students in face-to-face. You have improved the success rate in distance ed courses by 8% in 2 years. That's awesome. That is so fantastic. If you have not seen well, you can't see it here, but you can see it online. The 2021 Student Success Report is on the Provost website. Please go and take a look at it. We have continued a trend over the past several years of increasing student completions. This past year, we had over 11,000 students who completed an award at ACC. We surpassed our strategic plan goal, which was 10,000 next year. So you're already ahead of the game. I just can't emphasize enough how impressed I have been by the hard work that all of you have put into ensuring that students have not fallen through the crack, that they have every opportunity to succeed, and that this pandemic is not going to deter their dreams. I think most of you know I'm retiring at the end of this month, and it's been a very tough decision because I loved ACC. I love all of you. I love the students. I love our mission. We have done a great job. We've been a great team, and I have every expectation you are going to continue to take this institution to even greater heights going forward. I want to thank all of you for your friendship, your collegiality, your professionalism, and most of all, your dedication to student success. It's just been an awesome place to work, and thank you. Keep it up and go forward. So let me see. As Mike said, he's going to provide a communique with details on some of those questions. But again, keep in mind, it's flexibility. There are no hard ratios that we're trying to impose on anybody. And we're trying to figure out the best place for you to deliver your services and instruction. So I'm turning it over to Ruth and Samantha, who are going to talk about the student's perspective. So Ruth, take it away.
Thank you, Dr. Cook. Thank you, everybody, for being here and for your great questions. I think I'm speaking on behalf of Dr. Buchanan, who could not be here today, and also as part of the Back to Campus committee that I've been serving on for the last over a year. I do want to shout out to Dr. Garcia and Dr. Maines and Dr. Molly Beth Malcolm, because they have really been our guiding force in some of the work that we do on the committee. They are really always open to the concerns of staff and students as well. I always take the student perspective and staff perspective. And I know people are scared about coming back, but I applaud Dr. Garcia and Dr. Main's team for really keeping us safe on campus. You know, I've been back at campus and I feel very comfortable coming back. We've been on campuses. I applaud the Highland campus team that are back on campus. They've been back since July. We are going to be back at Round Rock and Riverside starting August the 2nd. So we're slowly coming back, but we need to be back. Some students do better in person and don't have the equipment they need to be successful in class. Yes, some of our students are scared as well, and we are seeing that in our enrollment numbers. But I think once they realize all the things that we are doing on campus to keep us safe, they will come back. And so I just want to say that I appreciate all of student affairs. I know there are a lot of questions about coming back to campus and who can work remotely and things of that nature. And Dr. Buchanan has been in communication with all of our team about that and what the processes are for applying for that. So I think we're ready to come back. We're excited. We are supporting all of our staff to come back safely. but just know that our students need us back and our community needs us back. And so it is important for us as leaders to kind of lead by example. And we really, I know people feel scared, but I think at ACC, we've been very fortunate. Like Dr. Rhodes said, we have been coming back slowly compared to our counterparts. So we're very blessed in that area, but it's still scary. And we recognize that. But I think the Back to Campus Committee really listens to our concerns and take it to the EOC. So just know that all the things that ACC is doing is really with the student and our staff and faculty in mind. Samantha?
Thank you, Ruth. Hi, I'm Dr. Samantha Croft. I'm the president-elect of the Full-Time Faculty Senate. So they asked me to be here today to help represent the faculty, and I'm also on the Return to Campus Committee for the last year and a half that we've been meeting. So I just wanted to say that while the Return to Campus Committee are not the ones making the ultimate decision, that's the EOC, I have felt very listened to. We've been able to bring concerns forward and see actual changes, policy changes based on what we're saying. So it's difficult for us to anticipate every faculty member's experience and fears and thoughts and questions. We're not a homogenous group, different campuses, different disciplines, different needs. So, as the word we keep hearing right now is flexibility, my word will be communication. So as we're going through this process, like I said, it's difficult to anticipate every single thing. So please be in communication. Please bring those things to the faculty senate or to whoever you feel is most appropriate, but especially the faculty senate, because I can bring those straight forward. That's the role of the faculty senate, and especially here and now, because now we're not only are we campus divided by campus, but now we're virtually and in person divided up. So communication is really going to be important so that we can help assuage your fears and make changes. Like I said, there are going to be hiccups. There are going to be things that we're like, oh my gosh, I never even thought of that. So just communicate, because as flexible as the administration has been so far, that will continue, as you've heard today. So just like Ruth said, I want to reiterate that we understand that that some people are afraid. Like it is. I mean, it's a scary situation. You feel a little bit out of control in what's going on in your world, especially for faculty who are used to running their classroom, being their own boss in a lot of ways. So we understand that there's a little bit of trepidation coming in, but I do want to ensure that you hear that the administration really is listening and trying. They're doing all of the things. We sit around and have conversations of every single safety thing that we can do within our our legal purview that we can do them, and it's sincere. We really are. Communicating what we hear from you, and they really are listening to us. So again, please continue to communicate. Please understand that this is a moving, ongoing, flexible situation, and that mandates are not coming as hard and fast as they sometimes seem on paper. This is what you will do. Talk to your department chairs, talk to us, talk to the administration. It really is a team effort. It has been, and I see all indication that it will continue to be. Okay, so I will hand it over to, let's see, who is next on our list. I'll hand it back to Dr. Rhodes.
I think we're going to have our student, Celia Parker, who, and Samantha, you talked a lot about communications. Well, Celia Parker happens to be a communications major and a member of the Student Government Association. So Celia, could you kind of give us your input from a student perspective?
Absolutely. Thank you, Dr. Rhodes, for introducing me. I did do a small survey, completely volunteered for students that I am connected with to share with other students. And what I've compiled and gathered here, students have a large desire for more information. And as Dr. Croft said, communication about how this process return to campus is going to go. They're also wanting continued support of the policy procedures and support systems put in place for when the pandemic began. I have a lot of students who are asking questions about those that have health concerns will it be mandated that they be on campus? If not, will there be some option for live streaming if the class that they need is only offered on campus? There's questions around how will social distancing work on campus? If there is an issue with a fellow student not wearing a mask and the student who is wearing a mask, how will that be solved? There's also questions around who to ask them, like who to go to. Is that something they're taking to their professors? Is that something that they're coming to any of you guys for? Is that something that will be listed on the website? And I think a lot of these questions are coming from lack of awareness of what ACC is currently offering, what they plan to continue to offer, such as they've had the coronavirus relief. They've had that fund. I know a lot of students weren't aware of. They have the child care scholarship that also can come with the textbook scholarship. A lot of students don't know about these resources, and they kind of feel as though they're drowning without that information. And so I think what I've gathered is that they're wanting more of that conversation with ACC and all of its representatives, management, leadership, to know what their options are and how best to move forward that works for everyone. And I know it was mentioned that the plan is to equally offer different platforms for classes. All of us are different. Each student is different. We all have different circumstances and different things that affect how we learn. And I think for these students specifically, there are some who are thrilled to go back on campus. As was stated, many students do well on campus, and that just is the nature of it. And there's also students who would love to be on campus, but due to other things in their lives and the lives of their family members that can be affected by being on campus, they want to still learn and they want to still participate with ACC, but they also need to be able to have that flexibility, which I think is the word for today, to stay home and kind of still be offered the opportunity to complete their higher education goals while protecting themselves and their family. And I think those 2 points are definitely the biggest that students are concerned with. I had a lot of feedback that ACC did do a lot and did support their student population this past year. A lot of students felt that there were professors and advisors and administrators able and available to them. So I think continuing that, answering this kind of unknown about what is going to happen, further supports students like myself to continue with ACC and to help you guys as much as you guys help us. I know a lot of it is centered on what we do, but we have to kind of come to you guys and let you know exactly what we do.
Hey, thank you, Salia. That's an important perspective, and appreciate that. And before I turn it over to Neil and Jerry, just a couple of quick questions that came in that maybe we could ask, and that is, number one, why can't we track vaccinations of our employees?
If you're asking me, and I'll try to answer that, because our state is not allowing that. And it is the same situation for masks. The governor did issue an executive order earlier in May saying that we could not do that. And then even yesterday, he issued a new one that strengthened and expanded the statewide bans on masks and vaccine mandates. So, and I'm going to quote from that. Let me see. I just found it, and y'all can all look it up. Today's executive order will provide clarity and uniformity in the Lone Star State's continued fight against COVID-19. Abbott said in a statement, the new executive order emphasizes the path forward relies on personal responsibility rather than government mandates. Texans have mastered the safe practices that help to prevent and avoid the spread of COVID-19. Well, we all know everybody's not responsible sometime, but we also know that we can't break the law. And that is what it is at this point. We are a public entity, public school. So all public entities have been told they cannot do these things. So all we can do is highly encourage, beg, plead, bribe, which we've kind of done with our vaccine clinics. We're giving away through the end of the month some prizes that people are in a drawing for if they do it before then. The other thing we've done, thanks to Dr. Rhodes and HR, is everybody is allowed 2 hours to go and get their shot as well, paid time to go and get their shot. So we're doing everything we can. If we could mandate them, we would. We just can't do that. We are funded by the state. I think all of us want to keep getting paid, so we don't want to get in trouble with the state.
Yeah, I think, isn't it like $1,000 fine per violation?
I'm not sure that's, you're probably right. I don't know for sure, but yeah, there is. It's per day, per violation.
Yeah. All right, thank you. So you answered both questions,
Oh, okay.
vaccinations and masks. So let me turn it over now to Neil and Jerry and talk about our employees.
There we go. I'll start off talking about, they've asked me to talk about our benefits for employees during this time period. And I just want to say they have not changed. ACC has a great list of benefits for our employees, and they will continue. So let me just highlight some of them. The first is, if you do have COVID symptoms or need to stay home, communicate with your supervisor first. And you can always use your sick leave that's available to all employees. The second benefit that is available is the Family Medical Leave Act. If you come into contact and you have a serious medical condition or catastrophic condition that prevents you from coming to work, then you would apply for FMLA. And that paperwork is on the HR website. Aliso Martinez is our FMLA coordinator, and she will work with you on getting that approved for you. In addition to that, if you need FMLA, but you don't have leave available, we do have a sick leave pool. The great thing about that is when our employees retire, they're able to contribute their sick leave to this pool, and they make it available to other employees. So if you run out of leave, then you're able to apply for the sick leave pool, and that will keep you whole during the time that you may have a medical or catastrophic condition. And of course, we have our EAP. We have had great success with our employees using that, particularly during the pandemic. We have a large number of employees that have gone to it for mental health issues, for family problems, trying to resolve some of their issues. So the EAP is always an option for you to use. And then lastly, the wellness program does have a number of workshops, online workshops, and articles and books for you to read. If you're just wanting to feel more secure about coming back to campus, you're concerned about your physical or mental health, and we do have some resources available on the HR website. So all of these are intended to help support you as you return to campus, but also just as you continue to be an employee at ACC. If you have any questions about those or any other related to your condition, please email me or Aliso. We'd be happy to talk with you about those. And I'll ask Neil if he wants to follow up with that.
No, thank you, Jerry. And I don't have a lot to add to that. I think, just more broadly, kind of with your initial point, Jerry, of kind of in terms of benefits, nothing's changed. I think it's very difficult with everything that seems to be changing to remind ourselves of that. But there's actually a whole lot of things, right, that are kind of the same that they've always been. They feel different. There may be some little things that are different, but a lot of when we look at what we do at the college, who we serve, what our students need, and how we need to go about doing, our work, the core elements of that really haven't, changed that much. Most of the changes, right, have been to us personally, which absolutely are important. But the good news is when we look at the core of the college, if we can kind of take a deep breath and focus on it, there should be hopefully, and this is our aim, is to provide stability in that. And I think we want to highlight the things that have not changed, because that's important, so we can focus on the things that truly are different. And so, I don't have an agenda or any talking points. I'm here when we get into the Q&A, to help answer anything. But I will echo all of the previous leadership's comments about how, given everything that has happened, the college is doing quite well. And based off the data, as Charles said earlier, it appears that that's translating to our students doing quite well. And that is amazing work on behalf of everybody. So thank you for that.
Great. Hey, Neil, while you're up, can you talk a little bit about the telework policy or administrative rule?
Yeah, I can provide a quick update. So this has been going on actually for many months. It was a draft of the rule was actually posted several months ago, went through the whole commenting process. Based off of those comments, we circled back and made some pretty significant revisions to what was originally drafted. To be honest, what most of it was simplifying the rule. The original rule that was proposed was 8 pages long. We've gotten that down to 3 pages, and then added, a little bit of additional language to the actual agreement that's proposed. It's now been posted again. It's gone through, basically it's now going through the whole process again. And it is out there right now. It was posted actually earlier this week for comments. It'll be out there for about 3 more weeks. For comments. I was actually looking at comments this morning. There's quite a few in there. And we will, Jerry and I are reading all of those and others, and we will continue to take those into account and refine them. And we're scheduled to bring that back to the Administrative Services Council at the end of August, for review again by that council. And then we'll see what actions they choose to take. But again, what I would try to highlight in there is there's a lot of language in there. And to be honest, I would like to continue to try to simplify it. But if you read most of it and you read the intent of it, most of the language is actually telling us that, our jobs have, whether we're teleworking or whether we're in person, whether we're hybrid, whatever it may be, the core of what we do is no different. And all of the other administrative rules, policies, and procedures are not changing. All that's really different, and this is where we need to kind of get to with this, the only thing that's different is in fact the actual location of where we do our work. But our job duties, our work schedules, how we interact with our managers, how we'll be evaluated, our rights to be able to, submit complaints, and, all of the other, things that the college has in terms of how we kind of go about doing the day-to-day work really are not different. We just need to get to where we can focus on those very unique things that are different about, let's say, a home office as opposed to an in-person office, which is really talking about, physical space and really furniture, fixtures, and equipment. And I think it's valuable to the extent that we can simplify that so that we can actually get to a rule. And the last thing I'll say on this is the college will not be able to put in a rule and procedures that addresses every scenario that is going to be out there in the vast number of operations that we have. So the rule will be intentionally somewhat generic, and then we'll push a lot of the responsibility to the managers and the employee to work out those details. And I get it that it's hard to get real comfortable with that because we like to see something that's very, very concrete and in writing, but that's actually not possible. All of our jobs and all of our teams are unique in their own right. And that's going to have to be worked out through collaboration at the team level, at the department level. And so I'm seeing a lot of comments in this teleworking rule where some people either want less or more in the rule. But if, again, the intent of the rule is to provide some parameters to management, and then it's basically saying, managers, you need to go work out the details as part of the agreement, which is a form that we're providing them to then put those specific details in there. There's really no other way we can do it if we want to do teleworking. We're going to have to figure it out department by department at the team level. And for what it's worth, for finance and administration and the 300 employees that kind of roll up under me, the message I have provided to any conversations I've had about this and to all of the managers has been, I want to see proposals at the team level, not at the individual level. I'm not it's not going to be valuable to me or to anyone for me to get 300 individualized teleworking requests or proposals. What I want to see are how's the team going to work going forward, and what is the staffing and scheduling plan for that team. And they need to take into account the constituents that they work with, the other teams in the other side of the college who are also trying to figure out how they're working in person or remotely. And I've told them that they have to take that into account as well. So even though a certain individual may be able to do everything and feel perfectly comfortable doing everything remotely, but if they have to collaborate with people that are primarily working in person, we need to take that into account, just like we do with our students. It's the same thing. We have to recognize that we have students that want that it's best for them to be in person, and we are going to support that and offer them in-person solutions. I've told my team that we have to have that same thing in terms of how we work with each other as employees. We need to recognize that some of our employees, they prefer, or it is better for them to work in person. And therefore, if we need to meet them halfway and be available to meet in person with them or their team, then we need to take that into account. So again, my point is that's going to be a different answer for every, I have over 40 different identifiable teams within finance and administration. I can't go in and just have a universal response to all 40 of them and all 300 individuals. So it's going to take some work at the team level to work this out, and we won't be able to solve that with the rule. So I just felt when you say that out loud, there is going to have to be some sit downs and some conversations and discussions, some one-on-ones, if we're going to make this work. Otherwise, if we can't figure it out, the default answer, if we just want a single answer that applies to everybody, that answer probably is we're all in person. So it's upon all of us to try to figure out how to come together and figure out how to make teleworking work at ACC. Otherwise, I fear that we'll end up with no teleworking because we just won't be able to figure it out. But I don't think that's where we're at. I think we'll figure it out, and we just need to continue the dialogue. So that's where the rule is. That dialogue's happening. Participate in it. If you're not sure where the link is, where you can go in and comment on it, let me know or let Jerry know. We'll be happy to resend that link out. The association presidents have that link, so you can also reach out to them if you need to know how to participate in that conversation.
Yeah, thanks, Neil, for that. And there's a lot of frustration because this is a time, a pandemic, and 16 months long. When if we go back 16 months ago, who would have ever thought that it would last this long? I know I wouldn't have. I thought maybe it'd be over in 2 or 3 months. So frustration kind of builds up, but there's frustration within employees, and there's frustration among our students. Many of our students really want some face-to-face communication and time. And so, Ruth, if I could just have you comment a little bit, what are y'all hearing from students, in advising and counseling and so forth?
Well, we have, since we're opened up, we have had some students who still see their advisor remotely. So they're liking both in terms of that kind of support. We're seeing both. But in Dr. Curtis's space, they do a lot of transactional documentation. And so a lot of our students don't have scanners, things of that nature. So they do have to come into campus and drop off their paperwork for admissions and things of that nature. I did want to say, I know people are asking questions about our Registration Express event that we're going to be having on August the 6th and the 13th. We are working with Dr. Garcia and Dr. Main's office and Dr. Malcolm's office regarding if we can still have it. I know those are a lot of big concerns because it is going to be a big event, but we are doing it by appointments because we really are trying to get our students back on campus in classes, whether that be hybrid, in person, or online. So we are working with them. We're not doing it in a vacuum. So we are looking at that information as well. So I know that's a big concern to a lot of people in the chat, but we are seeing I actually got a report yesterday about withdrawals, and a lot of students are withdrawing because I think that remote environment doesn't work for a lot of people because they're in a space, they have their families and things of that nature. And so we really are just trying to support our students. You know, unfortunately, we've always been on campus. We have a very small team that works remotely even before the pandemic. But we have learned a lot and we can support students remotely. However, there are a lot of students who prefer that in person. You know, we deal with students from all ages. And so I think about those older students who maybe aren't so good at technology. And so we have to kind of support the gamut of our students, you know, and be where they are. I think it's important for us to be back on campus and support students. It doesn't mean that all students are going to come back to campus and we're going to support them in person, but we can't, I mean, we have learned some stuff. We've learned that we can do it remotely. We could do it on screen with students, but if there's people who want to come in for an appointment with a person, we need to provide that as well. So.
Great. Thanks, Ruth. You know, another question that had come in had to do with, you know, as we look at in our different communities, whether it's in Williamson County or Travis County and different stages, how do we monitor that and how do we take that into consideration in things such as social distancing? I don't know, maybe this is Molly Beth or Mike.
Mike, go ahead.
Okay, so on the classroom front, so what we're seeing right now with Williamson County, Travis County, we're seeing really similar vaccination rates. We're seeing similar infection rates. So we're not currently seeing huge differences in those. As I mentioned earlier, we reduced, you know, we've done some things. We reduced class sizes. We really struggled with a 6 feet distancing. And so we're really going with 3 foot distancing, and we're doing that in all of our face-to-face classes. We're doing that. And we've been doing that from the beginning when we started bringing things back. And we're doing that in our interactions as employees come back, not necessarily in the classroom, but we're maintaining that distancing also. So we sort of have built that in. While we can't mandate masks and those things, we can encourage those, and we are. And so we hope people will take advantage of that. We're also doing, and I know we're doing this in student affairs also, if there are specific things that would be helpful. For example, some of our folks who are meeting individually with students or even in a classroom feel much more comfortable with a plexiglass shield in front of them, not the face shields, although you can do that too, but like on your desk so that you have that between you. And I know that we're doing that with advising, and we can absolutely do that, you know, with others too. We just need to get those requests in. So we have a lot of protocols in place, you know, to deal with this. And I think the last thing I would say to kind of loop it back again is that over the last almost year and a half, we have had a lot of ups and downs, and we have dealt with those accordingly as we've encountered those. And I think we'll continue to do that too, depending on the situation we're in. So we have protocols in place. We have a safety and operations team that's been working with us on the ground for almost a year and a half and helping us figure out how to implement and how to distance and how to do those things. So we will continue to do that too. So Molly Beth, I don't know if you want to add to that.
Well, I'm going to ask if Wayne or Mike Garcia, either one want to add to that.
Yes, I'd like to add to that. The work that we've done in safety and operations with instruction and student affairs we've looked at safety every way in every possible corner, how we want to do that. But the other challenge has always been logistics. It's finding the people to get them to the right campus. We have people from all over the college going that may have worked in Hayes, now are working at St. Gabriel through this and helped us meet those needs. And then every morning since this started, I usually pop into Mike's office, or I call him before he gets in the shower at home and says on his way to work and said, here's what we want to try today. And with Ruth, it's the same thing. We've done over 300 safety plans, and the safety folks that go out there, they're not only just working with Mike or Ruth at that level, they're talking to the instructors. Samantha, how many communications have you had with Mike Garcia to figure out how to make a laboratory work, even semi on campus and now full on campus? it's been a tremendous amount of logistics and communications by everybody. And as we step into the fall, that increases our need for logistics. But what we've done is we've freed up some people, and now they can go do other things, and they can be involved in making sure that every classroom's clean when it needs to be done. Sherion's team's just been phenomenal in working on getting us prepared for the fall. So hats off to everybody for doing that. And it really is about communication and logistics. And we're ready. We're ready to do this. And if something pops up, the same thing we've done in the last year and a half, we're going to do again. Get everybody in a room and figure it out. And then we'll go say, Dr. Rhodes, this is what we want to try. And that's what we do. And it's been very exhausting. I'm ready for a vacation. I have one coming up, but everybody stepped up to the plate and they're still doing it. And when you come here, if you haven't been here already, you're going to see it's going to work out. You're going to be okay. So I'm going to stop there.
The only thing I'll add is that we have multiple folks, Dr. Maines, Dr. Malcolm, actually monitoring the health department, their data, the information from the CDC. Dr. Malcolm's on a standing meeting with the big organizations in Austin. We have relationships with Austin Public Health, with Williamson County Public Health, and with Hayes Public Health. And so we continue to monitor that. My staff is monitoring what's going on in COVID within Central Texas. So we are on top of that, and we do communicate and have meetings on that on a weekly basis. So that's all.
And I'd like to add one thing. We've said that before. The big five is what we call them, which is Austin ISD, the City of Austin, Travis County, the University of Texas, and ACC. But when we have those big five calls, it's not just those of us from each of those organizations. It is also the medical directors from Baylor Scott and White and Ascension Seton and St. David's and Community Health Corps and many others. It's a lot of medical professionals as well. Throughout a lot of this, we met weekly. We now have stopped meeting weekly only as needed. We did have a call last week when they were talking about going back to stage 4 where we are in Austin. But that has been very, very helpful. And another place that we get information straight from all the horses' mouths, all the medical professionals, and that's what we've been listening to is the science. I would like to add that you know that we've had an app on our phones, the Appian app, that was kind of a screening that we did. We've discontinued use of it at the moment, but it is out there again, and if it becomes necessary, we will use that again as another tool for us.
Thank you. And I think it's time to close. So I want to say thank you to all of you, and thanks for this great hard work. We are a family. We're a family of river bats, and we're doing what's best. And, my commitment to you is that we will keep you informed. We're going to get the best information we can get, and, make sure that we get the right kind of feedback to make good decisions as we move forward. And what we've heard today is, we've got to remain flexible. We've got to remain nimble. We've got to have patience. We have to care for each other. We have the 3 C's, and so collaboration is so important. That's the communication, connection, understanding each other and where we fit in, and caring and showing that to each other and to our students is so critical as we move forward. We know these are challenging times. We've not faced anything like that. And I can tell you, I've never faced anything like this in my career in higher education of 40 plus years. But what we see is, when we support one another and give space for grace and understanding, we are stronger. We're stronger together. And so I want to thank you that you have made us stronger as a college. And I don't know about you, but I am so proud to be a river bat. So thank you all, and have a great day. Have a great weekend.